I will share my screen. Slide from the beginning. Let me see, where can I, is it here? Yeah, that's it. So, hello everybody. Thank you, Caroline, for giving me this opportunity to talk about the medical aspects of the treatment for gender dysphoria for adolescents. I would like to start with the statement that I think everybody should be respected. It's not my intention to judge gender dysphoric people or to bully them, but I do have sincere concerns with lifelong serious medication and amputation of healthy body parts. Now, I made an agenda. There is so much to tell, so I can only give an overview of some main points. I will say something about the manual of mental disorders, how they changed it, about puberty, what is puberty, about the Dutch protocol, about the puberty blockers, about cross-sex hormones, surgery, why are there twice as many girls wanting to transition nowadays, does it help anyway, and a conclusion. Now, starting with the diagnostic of the manual of manual disorders, the current one is DSM-5, and the previous one, 4, they said about gender dysphoria, sexual and gender identity disorders. But they thought, now that is too stigmatizing. It looks like there is an association with a psychiatric diagnosis, and therefore they changed it in gender dysphoria, an incongruence between one's experienced gender and assigned gender at birth. And also the International Classification of Diseases of the WHO took this over, and they moved the gender incongruence from the mental disorder section to the conditions related to sexual health. Oh yeah, you just heard me saying the sex, the gender assigned gender or sex at birth, but sex is of course not assigned at birth. Sex is determined at conception. When at conception, the chromosomes of the father and the mother come together, and you have 23 pairs. And you see here in the right bottom corner, the pair 23. That's the when it is a male, it's or when it is a female, it's XX, and when it is a male, it's XY, and that is in every cell of your body. And that is really impossible to change. So from a biological point of view, a trans boy is not a boy and a trans girl is not a girl. But for sake of easiness, I will just use the term trans boy and trans girl. But to make sure that you don't think that it's the same, that is possible. So what is going on? You see here a graphic of the Dutch gender clinic in Amsterdam. And I think that all clinics worldwide show the same kind of graphic. First, there's a low line with as adolescents who are referred to the gender clinic. But then from 2012, there is a growth and also an exponential growth in the girls who are seeking transition. So what is going on? And to find out what is going on, we first have to look what is puberty. So at puberty, 2 hormones, you see down here, testosterone and estrogen, start going to be produced. And they are produced in the so-called hypothalamic pituitary gonadal axis. In the hypothalamus, in the brains, there are the gonadotropin releasing hormone is going to start, and that releases from the pituitary luteinizing hormone and follicle stimulating hormone, and those hormones make that the ovary makes estrogen and the testes make testosterone. And the production of estrogen and testosterone is responsible for the development of the secondary sex characteristics. So what are those secondary sex characteristics? Girls, the hips get wider, breasts grow, pelvis and genitalia grow. ovulation starts, menstruation. For boys, the shoulders get broader. There's an increase in strength and endurance. The penis and the testicles grow, voice gets deeper, etc. But it's also a critical time for the bone mineral density. There's a fast increase in this time. For growth, here you see here in the figure on the right hand, the growth between 10 and 15, the growth spurts for a boy and a girl. And there's also a critical time for brain and psychosocial development. And when we have a closer look at the brain, what happens in the brain, the prefrontal cortex is a very important part of your brains, and that is a major development during puberty, but it only reaches maturity when you are 20 or 25, between 20 and 25. But it's very important for control functions of the personal and involved matters, such as decision making and planning and social behavior and self-control. And that plays an important part in the personality and interests. So we have in the Netherlands a famous professor, Professor Jolles. He's a professor in neuropsychology and a writer of the book, The Pubertal Brain. He says adolescents are caterpillars who are not yet butterflies. Their brains are unfinished and they are still under development. So they can't do everything yet, and we shouldn't give them too big tasks and not expect too much. They are in an emotional roller coaster. And just when you are in this emotional roller coaster, you discover that you think you are in the wrong body. Those gender dysphoric adolescents is a vulnerable group that has more than average mental health problems, including depression, anxiety, autism, self-harm, and suicide attempts. And the question is also, can they make a decision at age 11 that has serious consequences for their fertility and sex life, especially if we have seen that the brains are still developing in this way. So therefore, the Dutch, I must admit, we take more often the lead, started a protocol to adapt. They try to adapt the sex. And what they do is and this protocol is also rolled out over the whole world almost, I think. But we started it. So at age 11. At the start of puberty, that's officially called Tanner stage 2, they give puberty blockers. Then at 16, they give cross-sex hormones, so the hormones of the opposite sex. At 16 years, a girl can also already get a mastectomy. And when you are 18, you can have genital surgery. And you have lifelong, you have to use hormones during your whole life. So how do those puberty blockers work? Now, a puberty blocker is in fact a gonadotropin releasing hormone analog or an agonist. So what it does, it first gives additional of this hormone so that you get more testosterone and estrogen produced in the beginning, in the first couple of days. But then, after a couple of days, the brain gets exhausted and cannot release any of this gonadotropin releasing hormone anymore, and therefore the whole cycle is stopped and there is no testosterone and estrogen produced anymore. I have named here two examples, triptorelin and leuprolide. They are all used off-label. They are not registered for this indication. They are registered for treatment of prostate cancer or for sex offenders, but they are also registered, and I think that brought them the idea to use it also for pubers. They are also registered for how do you call it? For children who are coming into puberty too early, which is a medical condition, but when you give that for a couple of years, then you stop it, and those children have their normal puberty on time. So that's something different. So what happens was that when you give those puberty blockers, so the puberty is on hold. The development of secondary sex characteristics, of course, goes down. So there is an effect on bone strength. The reproductive organs stay frozen at the stage they were. There's a low sexual desire. There is an effect on fertility, effect on brains. And what is a little bit frightening, that the long-term effects are largely unknown. And when we look closer to the effect on the bone, then you see here a graph, and you see in normal children, so they measure bone density with a Z-score, and when the Z-score is 0, then it's normal. But you see that when you are 1, 2, or 3 years on puberty blockers, the Z-score becomes -1 and -2. That means that your bones are getting more brittle, and that means that you get osteoporosis, that you in future can have more fractures. And when we look at the effect on fertility for trans girls, the testicles stop developing. There's a general atrophy. And when you think in future, maybe I want to be a parent, then you should make sure that you save some sperm, but that it's difficult to harvest because it's not mature. During the way, you can stop your blockers for a couple of months and then to start sperm cell production. And then it can possibly be frozen. I've heard it's not 100% working. For trans boys, the vaginal, cervical, and uterine, there's atrophy. And when you want to freeze eggs for later, then you have to stop the puberty blockers for a couple of months. And when you are at that age, you are not thinking about the future and children. You just want to go on. So you don't want to stop those months, because then your previous symptoms, your previous self is coming back. So I don't think that they think often to do this. Now, and then the effect on the brain. So the maturation of the brain is also on hold. And the effect could be a lower IQ, memory disorders, or a slow reaction time. And you can compare it maybe with menopause effects. With hot flashes, also the memory problems, insomnia, and just that you feel awful. So when we look at studies, and of course, because I'm Dutch, I take the Dutch as an example. There was a Dutch study of 70 adolescents, and they looked how they behaved at the beginning and the end of the treatment of puberty blockers. And then they found that depression and emotional matters were found to improve, but feelings of anxiety and anger did not improve. And the gender dysphoria and the satisfaction with the body did not improve. And all subjects eventually requested cross-sex hormones, so they continued the treatment. And also other studies prove that there's no evidence that puberty blockers improve psychosocial functioning. And you can also read the product information of those puberty blockers. And when you look at the adverse event section, I think it is 2 or 3 pages, but also mental health issues are mentioned, such as severe depression and even suicidal ideation. Also there you can read that it are really serious drugs. So I said that all subjects eventually requested cross-sex hormones. That's what is here in the first sentence, but also in other studies that more than 96% is continuing treatment. So it means that only in theory it is reversible. Apparently, if you have started this puberty blockers, you want to continue. And this makes it difficult to investigate what happens when blockers are terminated, because there are so few people who are doing this. But we know that the hormonal levels might not normalize until a year or more after stopping blockers, which prolongs pubertal blocking. So it's a little bit risky to call this buying time to make a balanced decision, because in those years there's a lot going on. Because that's how they presented it, to buy time. Now, when you are 16, you can get cross-sex hormones. And then you have, that means that the development of the secondary sex characteristics of the desired sex. So for trans girls, it means that, and then you have to keep your puberty blockers, and you get in addition estrogens, the female hormone. So you will have breast development, a feminine body shape, more or less, testicular and penile atrophy. And for trans boys, they get testosterone, a deepening of voice, beard growth and hair and body hair, more masculine body shape, clitoral enlargement, thickened facial bone structure, a further reduction of breast tissue. I made the deepening of voice in bold, but probably more can be in bold because it means that I wanted to give to indicate that when you regret it and you want to go back, when your voice once is deepened, you will always keep your low voice. You cannot get your own voice back. And also those cross-sex hormones have serious adverse events. And I have made here a comparison between trans men versus non-transitioning women. So what would happen if they had stayed a woman? Heart attacks almost 4 times as many. Strokes almost twice as many. And for trans women versus men, thrombosis almost 5 times as many. Strokes almost twice as many. Heart attacks twice as many. Breast cancer even 46 times higher risk. So that's not nothing. And fertility, stop using hormones, but there's no guarantee for success. This apparently was successful. And then from 18, you can have a surgery, a genital reconstruction to imitate the opposite sex, which means for trans girls, the bottom surgery, the castration and removal of the penis, breast implants, facial feminization surgery. They get a neo-vagina, a penile inversion, more or less. And they try to preserve the sensitive spots so that more or less is successful. But the tissue is stiffer and the vagina is less deep. And there's no mucous membrane. The sexual response or friendly bacteria of a natural vagina are not there. And also there's the possibility of losing an orgasm. And anyway, the sex experience is different. For trans boys, they have in addition the top surgery, but they can already have that earlier. At the bottom surgery, they take out the ovaries. The hysterectomy, they can get a neopenis. There are 2 kinds of operation of surgery. The metoplasty, then they transform the clitoris into a mini penis, or the phalloplasty, and then they take they make it from a piece of skin from your leg or your stomach. And then they conceal the clitoris in the shaft of the penis. And you can then have an erection with a prosthesis. But of course, no ejaculation, and there is also risk of losing sensitivity. And anyway, the sex experience is different, to put it mildly. And then there's also, of course, risk always with surgery. That urethral fistulas, near the neovagina, urinary tract infections, narrowing of the urethral opening. 40% of trans men has complications from this erection prosthesis. And anyway, these are radical surgeries that irreversibly destroy a person's ability to have children of their own. So why are there then twice as many girls seeking transition? It are often girls with complex mental health problems, including sexual trauma, abuse, and autism traits. Boys, I have to say, are still the preferred sex. There's a disproportionate emphasis on physical appearance and a huge pressure to attain an ideal body, and dissatisfaction with their own body, fueled by the social media. And that made Lisa Littman bring the term rapid onset gender dysphoria in teenage girls. It comes out of the blue. They've never told that they wanted to be from a different, to be a boy, but suddenly they are. There's a link with the popularization of transgenderism in mainstream media and online. It is social contagious. Sometimes complete groups want to transition. And so it looks like a fad. That is also dangerous because that can go over, and in the meantime, you maybe have already done have taken the medication or surgery, and you cannot, it is difficult to go back. So then when we go again to this Dutch study from the 70 adolescents, that they have followed that up with the results from the cross-sex hormones and surgery. And their conclusion was that the gender dysphoria was alleviated and psychological function had improved. But however, there are important limitations to this conclusion. It was a small participant sample, only 55 subjects, so 15 were lost to follow-up, and we don't know what happened with them. Maybe they regretted it. We only know from one who died because he had complications from surgery. And also the measurement was very short time. The post-surgery follow-up out only for a year. That is, and in the beginning, everybody is very happy, but after a couple of years, then that can go over. It's also, they didn't look at physical health effects, like a risk of fertility and cardiovascular and bone health. And there was no control group. So this makes these optimistic results a lot more doubtful. Then I want to go to the Swedes. There was the largest study was done in Sweden on the total population. And it was also in sex reassignment procedures, both hormonal and surgical. And the study concluded that the patient was less likely to need mental health treatment after all the hormones and the surgery. But however, the journal and the authors had to issue a correction because on second sight, the results demonstrated no advantage of surgery in relation to subsequent mood or anxiety disorder related healthcare. And also treatment for anxiety disorders, patients who had sex reassignment surgeries did worse than those who did not. And that, I think, woke up the Swedes, because the Medical Ethical Council was suddenly calling for caution for treatment in young people. And also the Swedish Pediatric Society said, but from those children, you cannot expect that they understand the consequences of those decisions. And the National Board of Health and Welfare is going to update the treatment guidelines with more emphasis on psychiatric treatment. And what we see now is that the curve is going to, what I had the word, to deflect. And this might be a pity for teenagers who are seeking a transition, but I think it really protects them from hasty decisions. So what is meanwhile happening in the UK? We have here several people from the UK, I think, who know this all much better. There were parents complaining that their children had been fast-tracked through the Gender Identity Development Service without any serious psychological evaluation. And there were also doctors resigning from the clinic because they were worried that the diagnoses were made lightly and the problems not solved. And there was this lawsuit of Kira Bell, who stands almost a model for somebody with regret. She said that the transition was a very temporary, superficial fix for a very complex identity issue. And a 12-year-old cannot properly understand this type of intervention. So that is from experience from somebody who has undergone this. So now the NHS has changed its guidance to better reflect the dangers. So the claim that puberty blockers are considered to be fully reversible has been withdrawn. And also they admitted that the long-term effects are unknown. The claims that surgery has a high rate of satisfaction is gone, as well as the suggestions that hormones and surgery actually change your sex. And they have added warnings that you need lifelong monitoring by your general practitioner. And as with all surgical procedures, there can be complications. So, in summary, gender identity is a psychological phenomenon and not found anywhere in the body, brain, or DNA. Not all adolescents with gender dysphoria inevitably go on to trans identification, but cross-sex hormones inevitably result in irreversible changes for all patients. There is an increasing trend among adolescents to self-diagnose as transgender after binges on social media sites. And the adolescent brain is not sufficiently mature to make significant irreversible medical decisions. And parents should be well aware of those facts. We need to find better, more humane and effective responses to those who experience dysphoria. So what can be done to help? And I have written down here the treatment of gender dysphoria according to Dr. Levine. It's a clinical professor of psychiatry in the US. And he advises first watchful waiting, particularly relevant for those before puberty, treat any associated mental illness or symptoms in the child. Then he says standard psychotherapeutic approaches to distressed children address the underlying sources, because 90% of the children will then desist. And about affirmation therapy, he says that less than 20% of the children desist if they are affirmed during grade school years. In long term, regarding mental and physical health or social and romantic happiness, there are no studies that show more positive outcomes by age 25 or 30 than does watchful waiting or ordinary psychotherapeutic approaches. So he concludes desistance is the effective affirmation. And really that is the most difficult part. Because there is a tendency to evade this. Because you are not going into the requests of the patient, and also because it is, of course, a difficult job to give psychotherapy to these people. But what is nowadays also a problem is you run the risk of being accused of practicing conversion therapy, which is strange because you just don't want to converse their sex. So. In conclusion, let your brain mature before making any life-changing decisions. Being a woman or a man is not a feeling, it is not an emotion, it's just biology. Rejecting traditional ideas of what it means to be a woman or a man does not make you a man or a woman. Stick to reality. I have here the title of an article, and there are so many in this article, so many references to everything what I have said, because if you read this article, you can find there all the references. So I can really recommend this article. So thank you very much.